Dr. Sonu Goel. He needs no introduction. Terrific surgeon, excellent clinician and speaker, as we all know him. So over to you, sir.
Thanks, Sheetal. And I think we had a wonderful session all throughout for all the IOLs. So I'll just also try to brief up of the entire gamut of lenses that we had. So we all know that there have been repeated surveys by the EACRS, and there is definitely a drift in the international market from multifocal to trifocals and from monofocal to EDOF IOLs and modified monofocal IOLs. And I think that has actually helped us pushing in two ways, getting more finances and getting our patients more crystal clear vision. Now the challenges has been, as we have all discussed, the accurate IOL power calculation. I think residual refractive error is one of the key important point in when you're dealing with these modern IOL technologies, and I think we should all have the best of the IOL material in the type, and I think good surgery which includes proper centration and orientation of the IOL, because as we know, a tilt more than 2.8 or a decentration of more than 0.5 is very deleterious for these premium trifocal lenses. A quick word of the Holiday corneal power decision tree that we follow in our hospital. This is the patient lens up, goes directly to the keratometry. If the standard deviation is good, whether there is a toric, goes for a topography in the 4.5 central millimeter zone, and then we calculate out depending upon the Barrett formula. If there is no cylinder, directly goes to IOL Master 700, the IOL power calculation. If the standard deviation is more than 0.2, look for dry eye. Treat the patient for more than, between 4 to 6 weeks, and then we take the patient for the cataract surgery. Otherwise, if the patient still has on the topography, you find out keratoconus or a pellucid marginal, the patient goes on a tomography, pentachem, and then you calculate out the back surface and the exact power calculation. So I think this one good calculation is very important. So preoperative evaluation for all the lenses. So I think in modern day cataract, no lens is premium, but the patient is premium. So good dry eye assessment, topography, higher order aberration using a ray tracing, angle alpha kappa, specular microscopy, macular OCT, a good optical biometry is very, very important, and a personal touch to the patient for a few minutes, chair time is very important. Now, surgically, what is important is looking at the pupillary aperture. I think we all ignore the size of the pupil. So preoperative selection, pupil size is very, very important. During the surgery, the IOL tilt and the decentration, and that is where the effective lens position comes. So a good centered round regular axis, placing the lens in the bag, not compromising with the tilts, and taking care of the corneal aberrations is very important. And when we talk of aberration, we know that the corneal root mean square less than 0.3 is an ideal, but more than 0.5 is not acceptable in these lenses. Similar goes with the angle alpha, less than 0.4 is acceptable, but anything more than 0.5 or 0.6, I think monofocal lenses stand. So a quick word for the recent, the fine vision lenses that we've been using, amazing trifocal lenses, and a very small experience of 2 months, 50 lenses that we had. The patient had good distance, intermediate and near, with hardly any photoptic symptoms. So this is a 6 millimeter optic zone with 23 rings in the center. It has a central 1.1 bull's eye, and this is a double C-loop design, and these are frosted, and this actually helps in preventing the optic haptic snug or the kiss that we usually encounter with the other lenses, and takes time. It takes no time in unfolding. So this is always the leading haptic on the right, which guides you, because this has a 5-degree angulation. So this has always to be on the right side. And we have innovated because this helps us. Sometimes you can actually hook in the Kugeln here, and helps in dialing the lens within the bag at times when the pupil shut down and you feel that the lens is, the haptics are in the sulcus. So this has the diffractive pattern on the anterior surface and the toricity and the asphericity on the posterior surface, a good rotational stability, the availability both in the toric and the non-toric forms. And the lens design is actually what gives us a good toric stability. The material, it's a glistening free yellow material, a very long-term study over a period of more than a decade, and this has stood to the time, and this has been a hydrophobic material, a combination of both the UV protective and yellow lens. So minimal photic phenomena, and this minimal photic phenomena is basically attributed to the it is called as the co-pod design. And what co-pod design mean, I'll actually come in the subsequent slide. The second advantage with this lens is the near vision. I think this near vision outscores vis-a-vis all the trifocal, because it has a add of 3.5, and at the same time there is a higher energy allocation for near vision. And it has a very smooth transition between distances. That means intermediate, near and distance, and that is what gives you a continuous range or unified vision all throughout the distances. So this is what we actually mean with the co-pod design. And we all know these are the apodization, and this apodization along with the convolution. So convolutions, if you smoothen out these ridges, this takes care of the photoptic symptoms. At the same time, it helps in working in harmony with the pupil, managing the risk of glare and halos. So if you see the picture there, this is what the apodization, and these are the truncated sharp edges. The moment you make this surface convoluted, just watch carefully, this smoothens out, and this is how it takes care of the smoothing, and this actually transforms into this kind of phenomena. So if you have these truncated edges, you have these starburst phenomena, but the moment you combine it with the convolution, the phenomena is taken care, and this the night driving picture would look something like this. So I think with this co-pod design, which actually takes care of the photic phenomena. So it usually, as I said, for the near vision, so this is the distance intermediate and near at different pupillary sizes that the lens works. So this is the slide which shows the range of vision that this lens, the defocus curve, and this works almost greatly at all distance intermediate and near vision. And this is the design that we have. So with the C-loop design, you always tend to rotate it in a clockwise fashion, but this actually ensures that you can rotate the lens in either ways. So quick maneuverability is very important here. At the same time, it gives you that kind of rotational stability because the area of contact with the bag is too high. So it is available in the toric lenses also on the toric platform, and the toricity lies on the posterior surface of the lens. And at the same time, it has a low PCO rate, and this is basically of the pod design that it has. Long-term studies at various institutes has actually demonstrated over a period of 3 years, hardly any PCO rate, though we have a very limited experience of over 2 months, 40 eyes. So thank you very much. Sorry for the paucity of time. I had to rush for the slides just to introduce this wonderful technology to you all. Thank you very much, and I'll thank Dr. Mahipal sir for bearing with us for the shootout that we had on his session. Thank you, sir.